Hey everybody, so now what we're going to do is goniometry of the knee and the ankle. We're going to start with the knee. You can do both the actions of the knee, flexion and extension at the same time. So you're going to want your big goniometer here, and you're just going to have the patient first go through the action. So can you flex the knee for me? I do it for her, then she does it on her own. Can you do that for me on your own? Thank you. Good. And then go ahead and put it down. And so for extension, you're going to want to place a towel under their ankle just to make sure you're getting full extension. And so, Karen, just push your knee down as far as you can for me. The landmarks that we're looking for, fulcrum goes on the lateral epicondyle of the femur. And so that's going to be just basically in the middle of the knee joint, just above that. Follow the femur down. You'll feel the epicondyle kind of jut out, and you want to just get on the highest point of that epicondyle, which is right there on Karen. And then your proximal arm is going to be on the greater tubercle, which is right here on Karen. So I'm going to get this lined up. And then your distal arm is going to be lined up with the mid-calf with the lateral malleoli or malleolus as your landmark. Okay, so I'm right here with her, and we know already that at extension she's 0, so we've got our measurement for extension, and we're going to take this out and then we're going to do flexion. So Karen, can you go ahead and do that action I had you do earlier for me? Good. Okay, you can double check and make sure you haven't moved off of where you need to be. Okay, and we have 135 degrees exactly. So Karen is normal. If she wasn't at a normal range, I would still want to line that up. I forgot this part, sorry. Line it up and then get the passive range of motion, which should be further, but she just doesn't really have much more. This is going to be a soft infield because the calf and the back of the thigh are what are hitting each other, which is usually going to be soft. Your infield for extension is going to be a firm infield because of the ligaments and capsule in the knee. And that's how you do goniometry for knee flexion and extension.